The next is about the chikitsa sthana. There the first of the chapter is dvivraniya chikitsa. अर्थात dvivraniya chikitsa व्याख्यास्यामः यथोवा च भगवान् धन्वन्तरिः द्वौ रणौ भवतः शारीरः आगन्तुश्च तयोः शारीरः पवनपित्तकपशोणितसन्निपातनिमित्तः आगन्तुरपि पुरुष पशु पक्षि व्याल सरीसृप प्रपतन पीडन प्रहार अग्निक्षार विषतीक्ष्णौषध शकल कपाल शृंग चक्र ईशु परशु शक्ति कुंतादि आयुधाभिः अभिघात निमित्तः तत्र तुल्ये रणसामान्ये द्विकारणोत्थान प्रयोजन सामर्थ्यात् द्विव्रणीयः इत्युच्यते. Now ranas are classified as two, the sharir and agat. Vrana are in general translated as a wound. Of course, we will come to the definition of vrana also next part. Now, it's not necessary that the vrana has to be considered as only the wound. Of course, all the wounds are considered as vrana. But in case of the other conditions also, where there is a situation where the disease is irreversible, disease becomes irreversible, or the stigma of the disease can remain permanently, that condition also can be considered as prana. So, rana bhavam gataha, in case of the shashir upakrama, in the bhedavastha, the feature of the disease would be it becomes rana bhavagata. Rana bhavagata means where the disease is irreversible or the science of the disease, rather maybe the stigma, evidence that the patient has that kind of a disease is irreversible, that's considered as a vrana. Adeha dharanat is one of the component of the definition of the vrana, and that adeha dharana is to be considered as the same. Now, considering these aspects, Sushruta has categorized vrana into two categories, sharira and agam. Sharira is a wound which is formed from within the body or due to the abnormality of the physiological conditions of the body. It could be like a septic pathology which has occurred. They see sepsis in the body could spread either through hematogenous spread or from the contact, external contact. That hematogenous spread of the infections can produce the purulent conditions, which we often name as abscess in general, very closely abscess, not necessarily all the times of abscess, but abscess-like conditions can be considered as the sharira vrana, which is something like endogenous. Of course, in the current science, we do not consider this as endogenous because the infecting organism is exogenous. But there are certain other conditions where the wounds could be formed due to autoimmune disorders. Autoimmune disorders like SLE, vasculitis, which also can present in as a vrana. Ischemic pathologies, which also can present in the wound. All of them can be considered as a sharira vrana. So, sharira vrana are the wounds which are formed from within the body. Even the infective conditions have to be considered as a sharira according to Ayurveda, though from the current science point of view, they are not considered as endogenous, they are exogenous. Anyway, that's the difference part. Then agantu is due to the trauma of different sorts. Now, Sushruta has given examples, lists of some of those causes for the trauma, and in the present life situation, these may not be important conditions, whereas in the present conditions, it is mainly the road accident which come as number one, and then of course any other mechanical injuries which can occur in the industrial wounds and so on. So the causes for the trauma are now different compared to what Sushruta had. In Sushruta's time, the most common type of the trauma were due to the other persons, Purusha, that's another person injuring the his colleague or somebody else like, or due to wild animals. Interesting is that Sushruta has mentioned the other human being as the number one, then comes the wild animals. So maybe the man is more wilder than the wild animals. Then Purusha, Pashu, Pakshi, Vyala, Sarisrupa, etc. That's the different varieties of the wild animals which could produce a wound, or due to the fall, or maybe compression, or maybe the fire, or chemicals, or poisons, or at times it could be tikshna due to very irritant substances, or it could be like the sharp objects in the surroundings like shakala, kapala, shunga, etc. Or it could be due to the weapons used in the warfare, chakra, ishu, parashu, etc. These are the weapons used in the warfare. These are the different causes of the wound which are mentioned by Sushruta as the trauma. In the current rheumatology, we consider the road accidents, mechanical injuries in the industries as the number one, number two, and then of course all the other causes also are true for the case of wound as such. सर्वस्मिन्नेव आगन्तुगणे तत्कालमेव क्षतकुष्मणः प्रसरस्य उपशमार्थं पित्तवत् शीतक्रिया अपचारणविधिः विशेषः सन्धानार्थं च मधुकृतप्रयोगः इत्येतद् विकारणोत्थानप्रयोजनम् उत्तरकालं तु दोषोपप्लवविशेषात् शारीरवत् प्रतीकारः. In case of the Agantuvrana, immediately after the injury, the aim of the treatment, the management would be not about the doshas, because there is no involvement of doshas immediately after the injury. So you have to do the protocols of preventing the kshatak ushma, the heat produced due to the inflammation. So anti-inflammatory measures, they are required in cases of Agantuvrana immediately after the injury. So, suppose that's what we will discuss that part in the next chapter again in detail. Sadhyavrana. Sadhyavrana is considered that condition where immediately after the injury the approach of the treatment has to be there. And the primary approach of the treatment is to prevent the kshata bhushma, temperature being raised. Temperature being raised is a sign of inflammation. So preventing the inflammation. It's not rather, again, the word anti-inflammatory may not be very apt word. Rather, it could be preventive inflammation pathology. So it's not, see, anti-inflammatory is something which reduces the intensity of the inflammation which has occurred. But this prevention of the infection, prevention of the inflammation is the most direct approach of Ayurveda, and that it's a Shita Kriya Avacharana Vidhi. You will have to have Shita Kriya. It could be like application of the cold substances or Shita Virya Dravyas which have to be well. And the principle of the management would be like as you treat the Pitta dosha. Or Sandhanarthamcha, you have to promote the healing. To promote the healing, the primary healing, of course, that primary healing and secondary healing and their differences and how to approach that. We will discuss that part when we discuss the next chapter, that's the Sadhyavrana. But in general, Sandhana is the healing, to promote the healing, Madhukrita Prayogaha. So the approach is different. Whereas after a certain period of time, which is considered to be average period of 1 week or maybe lesser than that, either 1 week or lesser than that, when there are signs of the dosha upaplava, involvement of the doshas, that's now in the current terminology we use the word of signs of infections. When there is a sign of infection, then the approach of the treatment would be different. That has to be treated separately. Now doshopaplava visheshaha, the type of that doshopaplava or the complications of the inflammation or infections produced due to the wound could be of different types, and they are Panchadasha Prakaraha, 50 types of Prasarana Samarthyat, Yathoktva Vrana Prasnadhikare. Now we have discussed that part in the Vrana Prasnadhikare in the Sutrasthana again. It's a somewhat repetition. And Shuddhatvat Shodasha Prakara Hiteke. In the Shodasha, Shuddha Vrana is the next 16th type. So Vranas, wounds can be Sharira wound or the dosha yukta wound or dushta vrana can be categorized into 15 types plus 1 shuddha vrana. So totally there are 16 types of the vrana. Now tatra lakshanam dvivitham samanyam visheshikatya. Tatra samanyam ruku. The most common clinical symptom of any pain, any wound is the pain. So pain is the most common symptom of the wound of any sorts. The definition of vrana is vrana gatra vichurnane. Vranayati iti vranaha. The vrana is the which makes the interruption in the surface of the body is a vrana as such. That's one of the definition. In the other context, in Sutrasthana, the definition given is vranoti yasmat rudhopi vranavastu nanashyati adeha dharnat tasmat vranityachire bhusihi. The point which I referred earlier. Vranoti which can produce a surface interruption, and even after healing, the stigma or the scar remains in the body, and such a condition is called as vrana. That's why we will have to have a broader meaning to the word vrana beyond wound. See, wound, of course, is vrana, no doubt about that, but a lesion which can produce a stigma, permanent stigma, which can result in a scar formation, also can be considered as a vrana. A bit of that we have discussed when we discussed about the Shastirupakram. Then vrana is iti vrana. Vishesha lakshanam tu punarvata lilinga vishesha. Due to the involvement of the doshas, there would be specific clinical symptoms and signs of the doshas. Tatra शावारुणाभः तनुः शीतः पिच्छिलो अल्पस्रावी रुक्षः चटचटायनशीलः स्फुरण आयामतोदभेदवेदनाबहुलः निर्मांसश्चेति वातात्. The Vataja Dustavrana would be having either bluish or somewhat dark red color, and the temperature there around the area may be lesser than normal or subnormal temperature is possible, and the surface would have lesser discharge. There may not be much discharge, and or the surface may look dry. There could be continuous aching type of the pain or other acute type of the pain, like something like patient may feel like spurana, that's tremors, like patient feels tremor. That spurana is not a visible tremor, but patient feels that there is something moving around, or there could be something which is squeezing or pricking or that kind of a acute pain. Nirmamsasteti, where there is no growth of fleshy tissue or soft tissue is lesser. Now, this kind of a phenomena is typically seen in case of the ischemic ulcers. Ischemic ulcers, when the blood supply is reduced due to any reason, and particularly the superficial ischemic ulcers like vasculitis. A typical vasculitis ulcer where there is a necrosis initial, and necrosis of the capillaries would occur, and necrosis of the subcutaneous tissue would occur, and it may slough out. And later on, it fails to heal easily. It may remain there for a long duration, and of course it will be quite acutely painful. So very typically the vasculitis induced ulcers, it's a variety of the ischemic ulcer. Peripheral vasculitis, again vasculitis could be of three categories: vasculitis of minor vessels, middle or medium vessels, and the larger vessels. I would consider the vasculitis of medium and the minor vessels, smaller vessels, as the Vataja Vrana as such. Now, Pittaja Vrana, Shiprajaha, Pittanilabha, Kimshkodaka Abha Ushnasravi, Dahapakaraga Vikarakari, Pita Pidaka Justasteti, Pittata. Due to the acute involvement of the Pitta, the whole course would be acute. The patient would have more clinical symptoms of the sepsis, like raga, vikaraka, daha, burning sensation, or so on. So febrile episode would be there. Signs of infection would be quite prominent, and the whole area would be either yellowish or maybe bluish color swelling over there, and there could be the pus discharge, which is relatively thin and colored, like that of maybe reddish or whitish color. Serous or hemogeneous discharge would be presented. Kimshkodaka is hemogeneous, or the serous discharge could be occurring, and there could be multiple eruptions or pus forming pustules. Pustules could be formed around the area. This is typically due to a acute bacterial infection, or what we call as the purulent infected wounds. Wounds which are produced with the or which are accompanied the purulent infections. And in the purulent infections, the color of the wound is decided by the organisms, as we now know. A yellowish color, as you see, is typically of the staphylococcus condition. Streptococcus usually presents with the whitish color pus acid, so on and so forth. Proteus would be presenting with the greenish color, and so on. So the color of the pus may be, according to the present knowledge, is decided by the organism which is involved. But according to Sushruta, or maybe from Ayurvedic principles, the color is decided by the dosha. So now I think it's not a theory which is against each other. Rather, the idea like the physical condition which facilitates the growth of a specific organism is the target when we discuss about the doshas. And when we identify the organisms there, it's the effect of that physical condition. So that's how it has to be now understood. Anyway, the problem would be it's not possible to objectively define those physical conditions now. So we'll have to take it subjectively based upon the appearance. Now, anyway, in general, Acute infected purulent conditions can be considered as a Pittaja Vrana. Then Kapaja Vrana, Pratata Chanda Kandu Bahulaha, Sthulostaha, Stabda Sira Snayu Jalavatadha Katinaha, Pandu Avabhasaha, Mandabeganaha, Shukla Shita Sandra Pichilastavi Guru Steti Kapata, Kapaja Vrana would be having relatively less intense pain, and around the area there could be numbness, stabdha, numbness, and there could be the vascular vessels. The vessels could be seen around the area, and the most important is the osta. The edge of the wound tends to be raised, or there would be hyperkeratosis. The scar formation would not occur completely, and katinaha, hardness. The area would be hard, and it may look pale. The area may look pale. Mandavedana, then Shukla Shikla Sandra Pichilastravi, there will be whitish color pus. Now, this kind of a typical presentation is characteristically seen in case of the trophic ulcers. Trophic ulcers are those ulcers where there would be a absence of, or maybe impairment of, the neurological functions as well as the vascular functions. The neurological functions and the vascular functions are considered as a trophic functions. Trophic function in the sense which facilitates the growth. Now, when the growth of the tissue or capacity of the tissues to divide and multiply and fill up the gap has been affected, then that's considered as a trophic ulcer. Rather, the other way, the sensations which are received at the area, the touch sensation or the pain sensation, is one of the protective phenomena in the normal condition. Because you have the pain sensation or the touch sensation, you would not injure your cells. But in those conditions where this touch or pain sensation is impaired, there is a possibility that there could be a continuous injury due to the because the patient is not able to sense the source of the pain. There would be a continuous precipitation of the injury, and that results in a growth which is abnormal. Of course, the capacity of the tissues to grow is affected, and there is a continuous irritation. For both the reasons, the granulation tissue would not be able to cover the area. Though you may create all the other factors by which the complications can be prevented, there could be a granulation tissue which fails to cover the area. Rather, the granulation tissue becomes mature at the periphery only, and that mature granulation tissue becomes fibrosed. So you will have a fibrosed edge in the wound, which is very commonly seen. You might have seen in many of the patients of this sort, particularly chronic diabetic ulcers. They tend to become of this sort. And you will see only a pale tissue below the area, and this kind of the wound is very typically the Kapaja Vrana. So Kapaja Vrana almost equal to the trophic ulcers. All that important is all these features of the wound which are seen mentioned in Sushruta, they can be demonstrated clinically. But the only issue is in the current pharmacological point of view or current therapeutic point of view, these differences are not really adopted in the therapy, whereas from Sushruta's point of view or Ayurvedic point of view, these are the main therapeutic guidelines which you can select the line of treatment. Then in the Raktaja Vrana, Pravala Nichaya Prakashaha, Krishna Spota Pidaka Jalopachitaha, Turangasthana Gandhi, Savedanaha, Thumayana Shilaha, Raktastavi, Pitalingasteti Raktata. Now, Raktaja Vrana is where you will have bright reddish colored appearances. The lesions will be bright reddish colored, and that's a Pravaladalnichaya, something like coral, looking like coral. Then there could be even blackish eruptions, blebs of the blackish eruptions could occur. There could be Pitaka Jalopachita, multiple lesions could occur. Turangasthana Gandhi, there would be a smell which is ammoniacal. Ammoniacal smell is typically in case of the Turangasthana. Turangasthana is the horse shed. Horse shed, because of the urination, you will have that ammoniacal smell. Now, ammoniacal smell in a wound is typically presented of the ammonia producing organism, and among the ammonia producing organism which produces the infection is the Haemophilus organisms. Haemophilus organisms are the major categories of the ammoniacal produced organism, and the most common clinical complications of the Haemophilus infection is what we call as erysipelas. There will be a subcutaneous superficial sepsis pathology, and the sepsis pathology tends to be, it's a variation of the cellulitis. the body's defense mechanism are failed to control the infection, and hence there will be multiple eruption. Unlike that of a classical, what we call as cellulitis, there a continuous spread in case of the cellulitis would occur, whereas in case of the erysipelas there would be satellite lesions, multiple satellite lesions which are superficial, and then there would be necrosis in the area. And exactly the typical appearance of what Sushruta has mentioned as Raktaja Vrana can be seen over there. And smell, of course, Turangastana Gandhi, hemophilous organisms are known to produce that, but erysipelas can occur due to many other organs, not only hemophilous. Streptococcal pathology also can result in erysipelas. In that condition, the smell may not be the same. Then there will be severe pain, acute pain, dhumayanashila, burning sensation, raktasravi. There will be bleeding, more of hemorrhaginous discharge. Then todataha dhumayana prayah pitarunaabha tadvarnasravi cheti vatapittabhyam. Dvandaja vrana due to vataja pittaja variety would be having multiple days or burning sensation, and at the same time there is yellowish discharge or reddish discharge is vataja pittaja. Of course, it can be seen in case of again ischemic ulcers, then like the vasculitis. As is like the Vataja Vrana itself, it's a category of vasculitis condition only, accompanied with the secondary infections. The vasculitis could be the first image which we have seen in the vasculitis, which I have shown, is a non-infected vasculitis condition. Now the image which you see is a infected vasculitis condition. Vasculitis which has become infected, that's the Dvandaja, Vata, Pittaja variety. And important is identification of these conditions with the based upon the dosha issue is quite critical in the planning of the management. When you select the drugs for the management and approach to the management, that has to be important. Now similarly, Kanduyanashila, Stalistodaha, Rukshaha, Guruhu, Daruno, Muhurmuhu, Shitapichala, Alpastrabi, Cheti, Vatashleshmapya. Vatashleshmaja, Vata Kapaja Vrana also is now in the present point of view, it's a vasculitis condition only, but a vasculitis where there would be more of cutaneous reactions. In the vasculitis around the area, the cutaneous reactions would occur, and usually there may not be any septic pathology. You can see such conditions quite frequently in the clinical practice also. There would be a reddish and scaling of the skin around the area, which is usually seen in the recovery phase. The later part of the vasculitis conditions, you will see this kind of appearance where there could be itching, and often it may get confused with the eczematous conditions. And ruksha, the surface would be dry, and guruhu, darunaha, the surface also may become harder due to the fibrosis developing, and it tends to recur repeatedly. It may not heal completely. Murmuhu, shizapichala, recurrent conditions. This happens quite frequently in case of the healing phase of the vasculitis conditions, particularly venous ulcers, chronic, even varicose veins also, varicose ulcers also can present with the same eczematous changes. Like this occurs due to the stasis of the blood around the area. See, once the vessels are occluded, either in case of the varicosities where there is a stagnation of the blood, or in the vasculitis where the blood vessels are occluded, in the surrounding area there could be stasis of the blood and blood pigments, and that stasis of the blood and blood pigments produces the irritation which results in itching and the discoloration, either reddish or blackish discoloration around the area, and this is typical of Vata Kapaja Vrana. Then Guruhu, Sadaha, Ushnaha, Pita Pandusravi, Cheti Pitta Shleshmabhya. Rukshaha Tanu Todabavala Sutta Ivata Raktarnava Tadornasravi Vata Shoditabhya. And the Pitta Kapha Pittaja Vrana or Vata Raktaja Vrana. These are again the typical appearances which we see in case of infected trophic ulcers. A trophic ulcer which is not really infected, the first image. A trophic ulcer which is infected and presence of necrosis in the other image. Now, the first image, the clinical features are Pita Pandusravicha Pitta Shleshmabhya. There could be yellowish serous discharge. When the same becomes acutely painful, numbness of course is a common phenomenon, and there is a hemorrhaginous discharge. And that's considered as the Vata Raktaja Vrana. So, Vata Raktaja Vrana and this Pitta Kapha Pittaja Vrana, they could be considered as the two stages of the typical ulcers, like that of atrophic ulcer at that stage. Or Vata Raktaja also can be, these lakshanas can also be seen in case of the ischemic ulcers. To the Bahula Suttaiva, the numbness, this also could be seen in case of ischemic ulcers too. Then Ghritamandavaha, Meena Dhavana Toya Gandhi, Mrudu Visarpi, Ushna Krishna Stravi Cheti, Pitta Shonita. In the Pitta Raktaja Vrana, there could be acute sepsis, and due to the acute sepsis, there will be a pus which is like the Ghritamanda, whitish color pus, and the smell would be Meena Dhavana Toya, the fishy odor, the odor of fishy. Rather, in the present day situation, we use the term like rotten egg smell. The term used in the present terminology is the rotten egg smell. I don't think that there is a huge difference in the smell of a rotten egg and a rotten fish. I'm not an expert in that area. If at all you can make out that difference, that's fine. Otherwise, probably they are almost in similar category. Sushruta has suggested a rotten fish smell. Now, the usual technical term used is rotten egg smell, which is typical of a streptococcal infection, and there would be whitish color pus, and that's exactly what's considered as the Pitta Raktaja Vrana. And Visarpi, Ushna Krishna Stravi, it tends to spread rapidly. Streptococcal infections, they tend to spread rapidly, of course. It all depends upon the immunity of the patient and the location where it is. In case of a tonsillar infections, the first image is the tonsillar infections where you can see same, or a hand infection. Tonsillar infection, it may not spread very rapidly, whereas the hand infections, it tends to spread rapidly, resulting in necrosis of the tissue, and so on. Of course, whether it spreads or not will be depending upon many other variable factors. Then Rakto Guruhu Snigdaha Pichilaha Kandu Prayaha Stiraha Saraktapand Sravi Cheti Shleshma Shonitabhyam. Kapha Rakta Javrana would be reddish in color, and the surface would be shining, smooth, and there could be slight discharges. Itching also could be presented, and there could be hemorrhaginous discharge too. That's the Kapha Rakta Javrana. This is typically seen in case of a erysipelas, a standard appearance of the erysipelas. When you look at the textbook image of the erysipelas, the images are of that sort, where there would be initial reddish swelling which is extensive. Later on, it can result in the pockets where there could be hemorrhaginous pockets. That's exactly the typical feature. So, the typical standard representation of the erysipelas is the Kapha-Shonitaja Vrana. Of course, it also could be a similar complication of erysipelas where there could be local spots, could be considered as a Pittaja Vrana. The Spurana Tosla Dumaya Praya Pitta Tanu Rakta Stravicheti Vata Pitta Shonitebhya. Vata Pitta Kapha Raktaja Vrana. There would be huge hemorrhaginous discharges. Now, hemorrhaginous discharges which are present in the pockets where there would be Pitta Tanu Rakta Stravi and Spurana Tosla Dumaya Praya, acute sepsis. It can occur in case of many gram-negative infection pathologies. In the many gram-negative infection pathologies, which you might have seen in the ward quite frequently, often it's the Pseudomonas or Proteus organisms that there could be a acute pathology where there could be hemorrhaginous contents, and that blackish or reddish colored blebs are formed, and they tend to spread and often result in necrotizing complications, necrotizing fasciitis in the initial stages, or acute cellulitis due to gram-negative organisms. They are presented with the typical Vata, Pitta, Raktaja Vrana, Tridoshaja Vrana with the Vata, Pitta, Raktaja Vrana. Kandu Spurana Chumchumayana Prayaha Pandu Ghana Raktasravi Cheti Vata Shleshma Shonitebhya. In Vata Kapha Raktaja Vrana, there would be itching, and but the discharges would be thick and slightly reddish. Now, these kinds of the phenomena are commonly seen in case of a healing phase of a trophic ulcer. A trophic ulcer which is at the stage of healing, you may see the same. Itching is a common phenomena, and the surface discharges also would become thicker, and gradually it becomes constricted. A trophic ulcer which is at the healing phase, they could be considered as a Vata, Kapha, and Raktaja Vrana. Then Dahapaka Raga Kandu Prayaha Pandu Ghana Raktasravi Cheti Pitta Shleshma Shonitebhya. Where there will be severe acute pain and symptoms of the pus formation, symptoms of inflammation, and there would be reddish discharge, and even a plaque, harder plaque of the necrosis that also can occur in case of Pitta, Kapha, Rakta Javrana. This also is a typical phenomena seen in case of a gangrenous complication. Again, gram-negative organisms with the necrosis. When the tissue is necrosed at the area and the surrounding area has some other mixed infections, these occur quite frequently again. Mixed infections with the gram-negative spots and then necrosis of the tissue, somewhat gangrenous conditions, very close to the gangrenous conditions. These are considered as a Pitta, Kapha, Rakta Javrana as such. Then Trivida Varna Vedana Sravishosha Peta Pona Pitta Kapha. The Tridosha Javrana, where Vata, Pitta, Kapha are involved. There you may see the features of all the three doshas, like numbness and the darkness and roughness of the Vata, numbness of the Kapha, and the discharges at the demarcating area of a gangrene. So, in a typical chronic gangrene, you will see the Tridosha Vrana Lakshanas. Tridosha Vrana Lakshanas are seen. And Chaturdosha, Nirdahana, Nirmatana, Spurana, Tosataha, Karaga, Kandu, Swapabahula, Nanavarana, Vedana, Strava, Vishosha, Petaha, Pavana Pitta, Kapashoni, Tepiha, Chaturdosha. Now, Chaturdosha is a very typical feature of Sushruta. That's typically seen in case of what we call as a moist gangrene. See, the dry gangrene, there will be a localization, and that area of localization, there will be a typical demarcation line, and there could be a septic pathology. In a non-localized gangrene, where you will have the sepsis, necrosis, and the extensive spread towards the proximal side, and there is also a systemic toxicity, like the patient may have the toxic symptoms. These are typical of the Chaturdosha Vrana. Again, these kinds of the wounds also you might have seen. So, important is all those types of the Vrana which are mentioned in the Samhita, they can be seen clinically. The only issue is they, in the present day's terminology, they are not considered as the different types of the Vrana. Instead, they are considered as the different stages of inflammation, or they are considered as the result of the cause of infections and so on. So the approach is different, but they are identified importantly, and when you plan for the hybrid approach, all these have a practicality. The treatment, management of practicality, selection of diuretic drugs, they have a relevance. But when it is contemporary management, modern management, you may not have much of that difference in the approaches, except maybe selection of the antibiotics as such. So, that perspectives of these two have to be very clearly understood. The 16th type is Jihvatalabha, Mruduhu, Snigdaha, Stakshanaha, Vigatavedanaha, Suvyasthitaha, Nirasravashcheti, Shuddhavaranaha. The same is described in Sutasana with a different description. Tribit doshehi anakrantaha, Shava Vosthaha, Pidaki Samaha, Avedanaha, Nirasrava, Pranaha, Shuddha Ihochete. Shuddha Prana is a healing wound, the wound which is at the stage of healing. And this is typically described as a wound which has a surface which looks like a surface of the tongue, something of this sort, where you will have a clean, smooth surface due to the granulation tissue being formed over the area. And Shavavasaha, at the edge, there could be a bluish color, that's due to the mature granulation tissue. There will be pidaki, the uniform pidaki, there would be the pidaka, surface would have the appearance of papilla-like appearance, which is uniform, and avedana, there will be less pain and not much of a discharge. That's the typical phase of the wound healing. Now, Shushta in the Sutasana has described some more stages of that, the healing wounds. After the Shuddha Varna, the next stage is where Kapota Varna Pratimaha Yasyantaha, Kledavartitaha, Stiraha, Chipitikavantaha, Rohati, Samashikla. A Rohat Vrana would be when the edges become more and more thicker, harder, as you see in this phase of the wound healing, and the surface would become somewhat, the papillae or the polyp-like appearance, this becomes somewhat more prominent, raised as such, and cover, that's a Chipitika. Pitika and Pidaki and Chipitika, the differences are, Pidaki is a very small eruption, Chipitika are bigger and they look to be bigger, somewhat wider. That's the typical phase as such, as you see in this image. The Yasyantaha Kledavarjitaha, then they are considered as a Rohat Vrana or a Rukshamana Vrana, the stage of a healing as such. When the healing is complete, then as you see in these images, Rudharpanam Adrantim Ashunam Marujam Radam, Tvaksavardam Samadalam Samyak Rudam Nirdished. As you see in the last image, there in the last image, what you see is there will be no this irregularity, and Rudharpana Granthim, there would be no edge of the wound. Edge of the wound is not made out, and the surface is uniform, and there is no swelling. Pain, of course, is not present. Tvaksavardam, the only another issue is the color of the scar should be the same as that of the normal skin, which is not seen in this image. Otherwise, it's a Rudhavardam. So, that important is the purpose of keeping these series of the images from a source, net source, is to show that the features which are described in Sushruta, they are practically demonstrable and they can be seen as such. That's all the important issue, and phase of the healing can be clinically assessed. Now, the wound healing phases, that whatever Sushruta has mentioned, like Rukshamana and the Rudhavrana, it's exactly what we see in the pathology, or the clinical impression of the healing process. So, once the inflammatory process occurs, that's the typical Dushtavrana, and once the inflammatory process is over and there is a stage of proliferation, the tissue proliferation, that's either Shuddhavrana or Rukshamana Vrana. And once the tissue has healed and then there is a remodeling, all the areas or gap is completely covered up, that's the healed Vrana or the Rudha Vrana as such. Now, about the management concepts, the targets of the wound management, the present guideline in the contemporary surgery, whenever you manage a wound, the whole targets of the wound management would be preserving viable tissue and removing the non-viable tissue, restoring the tissue continuity and function, optimizing conditions for the development of the wound strength, preventing excessive or prolonged inflammation, avoiding infection and other impediments to healing, and minimizing scar formation. So basically, healing is a spontaneous process. All that what you have to do is facilitate that spontaneous process to go on smoothly without any impediments. Now, that's about the target. The same target is translated or is presented by Sushruta in a very brief manner as the Sapta Upakramas. Adau Vimlapanam Kuryata, Ditiyam Avasetanam, Tritiyam Upanaham to Chaturthi Patana Kriya, Panchami Shodhanam Kuryata, Shastam Ropanam Nishyate, Ete Kramaha Ranastyopaha Saptam Vikutapaham. Now, the 6 points which are mentioned in above and the 7 points which are mentioned in Sushruta, they are almost similar. The Vimlapana is about removing the non-viable tissue and preserving the viable tissue. Vimlapana and Avasetana. Upanaha is to prevent the infections, the septic complications. Patana again is once there is an infection, it has to be drained out and removed as it. And then Shodhana, healing, promoting the healing, optimizing the condition for the development of the wound strength, or the Ropana. And Vaikratapa is minimizing the deformity which could be produced. So they are the same as such, which are the main targets of the bone. The only difference is the Paka or the pus formation is considered as a common sequelae of any of the Vrana formation, and Paka is not considered as a complication by Ayurvedic approach, because the suppuration of the pus formation can help in removal of the dead tissue or non-viable tissue. Non-viable tissue can be expelled out by the sepsis, and that sepsis is considered as a tool of removal of the non-viable tissue from Ayurvedic approach point of view, whereas from the contemporary science point of view, sepsis is always considered as a complication, and all your effort is to prevent that sepsis. So that makes the difference in the approach. Now, I am not saying that the approach of Ayurveda is better than the contemporary science. That's not the point. But there is a logic behind that, and there is also a issue which is practicable. Prevention of the sepsis, of course, should be the primary target. Wherever possible, you have to prevent the sepsis. But once there is a sepsis, it's not an alarming sign. It need not be considered as a complication. You will have to consider this as an advantage in the course of the healing. And most of the times, though we ideally consider prevention of the sepsis as the approach to the treatment, it is not preventable, and when it occurs, it's instead of having a negative approach, it has to be taken positively. Now, that's about the point. Now, coming to the next part, that the same upakramas, sapta upakramas, they are detailed and they are described in detail into 60 procedures depending upon the condition of the patient, and to provide for the variable stages of the wound condition, they are considered into 60, and they are अपतर्पणम् आलेपः परिषेकः अभ्यङ्गः स्वेदः विम्लापनम् उपनाहः पाचनं विस्रावणं स्नेहः वमनं विरेचनं छेदनं भेदनं धारणं लेखनं येषणम् आहरणं व्यधनं विस्रावणं स्तीवनं सन्धानं पीडनं शोणितास्साबनं निर्वापणम् उत्कारिका कषायः वर्तिः कल्कः सर्पिः तैलं रसक्रिया अवचूर्णनं रणधूपनम् उत्सादनम् अवसादनं ऋतुकर्म दारणकर्म क्षारकर्म अग्निकर्म कृष्णकर्म पाण्डुकर्म प्रतिसारणं रोमसञ्जननं रोमाभरणं बस्तिकर्म उत्तरबस्तिकर्म बन्धः पत्रदानं कृमिघ्नं बृंहणं विषग्नं शिरोविरेचनं नस्यं कवरधारणं धूमो मधुः सर्पिः यन्त्रम् आहारो रक्षाविधानमिति. Now these 60 procedures do not mean that in every patient you have to follow all the 60. It depends upon the stage in which the patient has to come. It's a package. The all 60 procedures are a package given to you. If you have the provisions for these 3 procedures, any wound can be managed. You may select 1 or 2 or maybe more than 2 or 3, any number of them depending upon the stage. Like if the patient has come to you in the initial stages, your approach would be to prevent the infections. That's the inflammation. So before the wound has occurred, if the patient comes to an inflammatory swelling condition, then you have an approach to prevent that. That's षड्विधः प्रागुपदिष्टः शोकः. तस्य एकादश उपक्रमाः भवन्ति अपतर्पणादयो विरेचनान्ताः. अपतर्पणादि विरेचनान्तः, that's 11 steps from the apatarpana to the vireka, are mainly aimed at the prevention of the septic complications. See, once the inflammation occurs, the Ayurvedic approach would be to prevent the infection. Then even in case of if there is a infection, these are not contraindicated, they could be used as such. Then the next part is once the sepsis has occurred, then you have to have a controlled infections, controlled sepsis, that's the pachana. Then once the pus has been formed, it has to be expelled out either by any of the shastra procedures. That's exactly what's mentioned. Teshu kashaya vartihi kalkaha sarpit tailam rasakriya avachurnamiti shodhana ropanani. They are facilitating the removal of the pus and promoting the healing. Shastra krityaha, teshu astau shastra krityaha, 8 of the surgical procedures, if necessary, depending upon the condition of the wound, you may have to have any surgical procedure like either incision or maybe excision or maybe probing and so on. Then Shonitasthapanam, hemostasis is one of the important issue. Kshara, Agni, Yantra, Ahara, Raksha Vidhanam, Bandha Vidhanam cha Uttam. These are the accessory procedures like prevention of the sepsis with Raksha Vidhana, bandaging and Kshara, Agni, and of course the nourishment. Food also has to be considered as one of the issue. Sneha, Svedana, Vamana, Virechana, Basti, Uttara Basti, Shiro Virechana, Nasya, Dhuma, Kavara Dharanani, Anyatra Vakshama. In the present chapter, these issues are not discussed because they are discussed in another chapter. Yadanyad Avashishtam Upakramajatam Tadihu Akshare. Out of these 60 procedures, the remaining are discussed in this individually. Each of these are considered as the issue. And that's a very important point. The next is the Apadarpana. We will continue this with the next session, the 60 procedures with assets. I think we will stop at this point. If there are any questions, we will try to answer, and then we will continue with this in the next session. There are some questions like, does the type of prana occurring depends on prakriti of a person? That kind of a study is not done, so I am not sure. Maybe it may be possible that prakriti could be one of the factors which decide like which type of prana would occur. Rather, from the current point of view, if at all you have to look at from the current point of view, which type of the organism produces the infection. The common sense would say like it is about the contamination organism which is present there, but there is a factor, the inherent factor of the body also, which can maybe impact upon the type of the organism which is grown over the area, and hence maybe prakriti also may have an effect as such. How to cure chronic varicose ulcer. Of course, that treatment of varicose ulcers, chronic ulcers, we will be now discussing when we go into the upakramas, different upakramas. At that point, we will refer to that part. Okay, right. Anything else? Right.